Afternoon. This is the House Appropriations Committee. It is Wednesday, February 12th, 2025. And it's almost 3:30. We really appreciate patience of our next guests because we were running late. But we're glad to have you here. We have the Department of Corrections with us here. Were you in during budget adjustment?
Yes.
You were. Okay.
It was very short.
Remembering. Okay, so we will not have to go around and reintroduce ourselves, but we have the Commissioner General and Deputy Commissioner Calver with us. So welcome, introduce yourselves for the record, and I think we have your information in front of us.
Great. Well, good afternoon. Thank you for having us. My name is Nick Dimmelin, the Commissioner of Corrections.
Hi, everyone. I'm Kristen Calver, Deputy Commissioner of Corrections. Nice to be here with you again. So for our presentation today, we have a brief DOC 101 for you, and then highlights of some of our larger budget requests that we'll walk through the ups and downs with you after this first packet.
Great. Well, they only trust me with doing the 101 portion, and then we hand it to the smart folks for the money. But wanted to give you just a brief overview of our system, knowing that can help to really conceptualize what we're asking for and why. Vermont runs a relatively unique correctional system. We're one of only 5 states in the country that have what's called a unified correction system, meaning we have everybody who's in any type of detention or incarcerated status in the state. So that means if somebody's arrested with a crime, they're brought to a jail, typically. In Vermont, they're brought to the state system. And then likewise, for folks who are sentenced to serve a period of incarceration, they typically go to a prison. In Vermont, that's all one system. So we have about 1,500 incarcerated individuals today. About 2/3 of them are sentenced individuals. So they're serving a sentence of incarceration, and about 1/3 are detainees. So those are folks who are still awaiting trial, but either being held on conditions or held with bail imposed or held without bail. We are also the only Department of Corrections in the country that's housed within a broader agency of human services. And we like to highlight that that's both important practically and symbolically. Practically, we're housed with the other departments of state government that provide direct service to folks, like the Department of Mental Health, the Department for Children and Families, and many of the clients that we serve are also served by those other departments. And so it creates more seamless case management for individuals, better access to services. Symbolically, I think it's important because it says that here in Vermont, we view corrections as the provision of a human service. And that comes with greater responsibility than simply keeping people safe and secure behind walls. It also means helping people rehabilitate and get ready to go back into their communities. We have 6 correctional facilities across the state. They are mixed. They house both those detained and sentenced individuals. There's 5 facilities dedicated to men and 1 facility dedicated to women. And we also have a small percentage of our population out of state, currently in a contracted facility in Mississippi. And then the other part of our system is our community supervision side, and that is probation, parole, furlough. We have 12 district offices across the state that serve geographically dispersed around the region. And those folks supervise our population who are out in community. Today, I think we have just over 4,000 individuals who are on community supervision out in our communities. One other aspect of our system, we also run our own academy. We do all our own training in-house, and the Vermont Correctional Academy is currently located in the Lyndonville area. We've been running very large academy classes for the last 3 years, which is a good thing. I'm sure we'll talk a little about staffing today, but that group manages all of our new training for cadets coming into the system, and then also all of our core competency and career training as folks continue through their career in DOC. We have about 1,000 staff overall, making us one of the larger departments in state government. We have about a $230 million budget, and it's nearly entirely general fund, which I'm sure you're well aware of. We have a couple of other slides that talk about different demographic aspects of our system. I won't go too much into depth on that, but wanted to include those there for your awareness. And wanted to just then call out a couple of items that we think are key priorities that we're focused on right now. Staffing remains our top priority in trying to adjust our system to improve the workforce needs of the people who work in our system, and then also increase the number of folks who are working in our system to better achieve our mission. Over the last several years, the administration has put in substantial sums of money to increase pay, to provide additional benefits to our correctional officers and correctional staff across the state. Just in the last contract, we adjusted and created a correction-specific pay plan, much like the Vermont State Police. And so now correctional officers and department staff are paid on a different pay structure than other state employees. And that was really recognition of the fact that many of the benefits that we had negotiated as side letters to our existing contracts, we thought should be made permanent and built right into folks' permanent salaries. So over the last 3 years, we've put about an additional $30 million in additional pay and compensation for correctional staff. Part of the reason was to help improve our recruitment and retention efforts. And part was to really show the commitment to correctional staff, the public servants who are working in these facilities across the state. We've also made other changes for our staff. We've changed our schedule structure. We've sought out new ways to engage staff and improve the experience of staff in correctional facilities. And we've seen some great results from that. We hit a high watermark in vacancies in July of 2022. That was about 32% vacancy rate among our security staff. Today, that rate is about 19%. So we've seen a precipitous decline, but I'll be the first to tell you we've plateaued a bit. And I think that's a reflection of a lot of challenging forces all playing in at the same time. We have difficult demographic situation in the state of Vermont. Our workforce, the available workforce is shrinking, but we're also expecting folks to work in really difficult conditions and do a really difficult job. And they're working a lot of overtime. And certainly there is burnout occurring and folks, it's unsustainable after a while. And so that's where the department has spent its last 3 years, is really focusing on improving the staff and staffing of our correctional facilities. But that's not the only thing we've been doing. There are other areas of high priority to us. And the next one I wanted to call out is the health of our population. So we contract out health services. So that's primary health care, some specialty care, it's mental health care. It includes some of our treatment programs. But historically, that was how the department provided health care. And we failed to recognize how the social determinants of health, all these other things, impact somebody's overall wellness. So with the theory that if folks get healthier while they're incarcerated, they're more likely to go back to community and be successful, we set out on an ambitious project to redesign our health system in the Department of Corrections. We're still in that process right now, but there are many exciting things happening there. But the bad thing that I call out is really since the end of the pandemic, we've seen major negative trends in the health of our population. And I don't think that that's because they're incarcerated, although I don't think that helps necessarily, but it's because the folks that are coming into our system are coming in much sicker than they have in the past. The substance use issues amongst the population we're serving are very high. The chronic health issues among our population are very high. To give you some examples, something like 97% of our population are on prescription medication. The average number of prescriptions that an individual gets in the correctional system is 5.5 per day. I think close to 60% of our population are on psychotropic medications, so mental health medications. Almost 70% of our population are on medically assisted treatment. That's the medicine we provide folks who have an opioid use disorder. And so these are trends and data points that I think are important to appreciate. And it shows how complex and often the number of co-occurring illnesses that folks are suffering from while they're incarcerated.
And I want to ask you a question.
Yes,
It sort of jumps back to a previous slide that we kind of went over very quickly, but it's related to the folks there. And when you talk about all the trends, are you including detainees in this or just the other groups that
The health trends?
Yeah.
Yeah, so that would include our total population. So, yeah.
So I am concerned about the detainees because these are people that are awaiting trial.
That's right.
And when I was in corrections a few years ago, it was, 100 people or more fewer. It seemed the trend on that seems to be upward. And that obviously adds to your costs and adds to all of the things that you all need to deal with. Are any of the detainees or is it in 882? I know that we have had problems with people who could be released, but for the fact that they don't have any housing. Is that part of the 551 or is that part of 882?
No, that would be, well, that can occur on both sides of that equation.
Okay.
I think what you're asking about though is the detainee population. So that would be part of the 551 on there. I have today's numbers are 543, very close. So there is a group of folks who are detained, but have a condition of their release that requires them to have approved housing. And if folks cannot secure approved housing, then they can't meet their condition of release and they're held detained. And those conditions, I'll just clarify, for detainees, those conditions are set by the court. So the Department of Corrections does not control who is detained in the system.
There's a lot of people who don't meet whatever the conditions because we can't provide them outside of the facility. So they are there because as a state, we're unable to provide.
That's right. I mean, I'll highlight this on the other side of the equation, on the sentence side of the equation, and I don't think we capture it in our slides. But the Department of Corrections here in Vermont has one of the nation's most robust transitional housing programs. It's rare that a Department of Corrections provides transitional housing for individuals living incarceration, but in Vermont, we do that. And we certainly would do more of that, but there are not available units online. So we have the resources to be able to turn on more transitional housing, but there are not providers with units that we could do that. So we do provide a robust amount of transitional housing support to folks, but it certainly is not enough for the need of the population.
Right. And all the costs, we talked about health costs and so many higher percentage. So the detainees are in that. So your costs it's pretty expensive to house folks versus housing them for their conditions of release, if they could be in housing.
Yeah, it's
definitely less expensive than living with you.
Right. It is expensive to house somebody in a correctional facility anywhere. It's very expensive in Vermont. That's true. But I think that cost speaks to the level of service that's being provided in Vermont also, which is good, but
we need to fix some things on the outside so that we can get people.
That's right. I mean, in the Agency of Human Services, we often talk about there's kind of three places that folks end up at the end of the line, the last place they go, and it's corrections, an emergency room, or homelessness. And it's because those places have to take people. There is no option. We don't turn people away at the door. If somebody's sent to a correctional facility, we take them. If somebody's sent to an emergency department, we take them. And if they don't have anything else, they end up homeless. And so when you look at those end of the line options, they're pretty dire.
Yeah.
I just was curious about the number of transitional beds that exist in the state.
I don't know the number.
241.
Thank you.
Oh, okay then.
That's 241.
That's how many that we fund. I'm not sure that all of them are.
Not all of them filled right now.
I don't know off the top of my head.
That's fine. No, that's fine.
Okay, tag on it, so continue on.
Push on. So while we're talking about the health space, I just did want to flag, there's some exciting things going on. We've redesigned that health system. We brought in a new executive who's running the health system. We have a new healthcare vendor as of about a year and a half ago, and that's actually gone quite well for Vermont. The most exciting thing, though, I think, is the federal government recently approved certain states to obtain what's called an 1115 waiver. So a waiver to expand your Medicaid services. Under existing federal law, folks who are incarcerated are banned from participating in Medicare or Medicaid. And so if you're arrested and brought to one of our facilities, your Medicaid stops. And it doesn't start again until the day that you leave. And there's limits on how much we can help get folks connected before the day that they leave. The 1115 waiver is an opportunity for states to expand eligibility 90 days prior to somebody's release from a correctional facility. And so that will give us 90 days to connect folks with primary care providers, get them enrolled in Medicaid, help them with bridge prescriptions, connecting them with outside providers. That's really a major policy turning point for the country, but it will be experienced here in Vermont. Vermont's one of the first states that was accepted by the federal government to have the 1115 waiver. So that will go live in Vermont, estimated for January of 26. And part of the delay there, it sounds like a long time, but the delay is really helping the state build out its Medicaid billing system to be able to handle the changes that are coming down the pike. But that's gone great so far, and it's a combined effort between the DEVA, the Department of Vermont Health Access, and the Department of Corrections. So just wanted to flag that. That'll be a major step forward for our system.
Who has a question?
Yakavoni.
Okay, before Representative Iacoboni, so 6 months from now, no, not 6 months, almost a year from now, part of your medical expenses will be covered by Medicaid then under this waiver?
That's right. Yep. Medical expenses, reentry expenses.
For all?
For individuals who are sentenced and who are 90 days pre-release. So 90 days from the date that they will leave a correctional facility.
Okay.
There's a catch. All the money that we save has to be reinvested in reentry services and that work in the state. But we view that as a good thing. And certainly that'll add additional
Want to
resources.
do anything? Hopefully.
That's right. Yep.
Representative Iacoboni and then Representative Dickinson.
Can you tell me what our recidivism rate is?
Yeah, roughly. I mean, we would estimate that it's somewhere in the high 30% to low 40% range. I think it's an unreliable statistic though, so I caution to not
Why
overweight
is
that
that?
so much. But yes, it's you know, high
Why do you think
30s.
it's
or low
unreliable?
There's not a national standard to measure recidivism. Many states do it differently. Our system's particularly complicated. So for example, some measures of recidivism measure reincarceration. So have you been reincarcerated within 3 years of release from the last time? Some measure rearrest. Have you been arrested? Some have a hybrid model. And so those statistics get a little misleading. What I will say is over the last few years, our risk assessment numbers, so that's what we use a validated tool to determine what's your risk to reoffend, what's your risk to the community, risk to victims. Those risk scores have skyrocketed. Our population has decreased and our recidivism rate has stayed the same. And so what that tells me is we have a more complex population that we're serving, folks with higher risk to the community, and yet they're not recidivating at a higher rate than the population that we had before. So I think we're going in the right direction. But again, I struggle to rely too much on that statistic.
Thank you.
Okay, Representative Dickinson, then Representative Senska, and then Representative.
I want to go back to the 1115 waiver.
Yes.
90 days before they're released, a sentenced inmate will be able to get healthcare through Medicaid. It will be paid for by Medicaid. Now that will that be through the same group that you contract with, or will you have to find other vendors, other physicians, other?
It'll be for those 90 days that they're still incarcerated, it will reimburse the healthcare costs through our vendor.
Through your vendor.
Mhm.
And has anybody sat down and looked at what that would cost or how many people would even be affected by it?
Yes. We predict it'll be about 1,400 folks. That's based on the data that we have currently. In this first year where we'll execute the waiver, we'll be able to fine tune that for subsequent years. But it is included in our ups and downs, so we can talk about the funding when we get
So
to
you
that
scheduled
point.
that for 26?
Yes.
Even though it starts in January, you're going to be looking.
Correct.
All right, okay, thank you.
So,
Couple of questions related to Representative Iacoboni's question about recidivism here. Is there a year or time following release, reentry back to the community, when you see more of that happening?
If somebody's gonna commit new crimes. That's a good question. we have pretty good data on this topic
Yeah.
that we could look at to assess that. So the recidivism look back is, I think, a 3-year look back. So the data is always 3 years behind.
Yep.
But I think we could pretty easily identify if there are spikes at certain
I'm
time
just curious about that.
Yeah, I don't know off the top of my head.
Someone may be, incarcerated for, some time. Or wait for the TV to come.
Yes, right.
Because sometimes people, they're released, they re-enter the community, circumstances sometimes lend themselves to. They're still housed in transition, winter's coming along, and there's that propensity.
Yeah.
On occasion, I'm not sure how many, I'm not trying to say this is the reason why, but I can imagine someone thinking if I do something else,
Yeah.
I'll go back in
I would-
bed and get through a time period. I don't know.
I haven't looked at this data too
That's a
closely,
big assumption on my part.
but I would guess it would be relatively quick. That it happens usually within the first 6 months or a year,
Sure.
I imagine. But we can certainly pull that.
Yeah, I'm just curious about that.
Yeah, absolutely.
Thank you.
Representative Laurel?
Just to follow up to Lynn's question, you said 1,400 would your estimate to be able to take care over what duration of time?
A full year.
In a year, 1,400 in a year. Okay, looking at your graph, your detainees slightly trending up in the last 2-3 years. Number of sentenced individuals staying pretty much flat. Does that reflect what's coming through the court system? Because we've had a serious bottleneck there. I know last I heard we had 94 unadjudicated murders sitting out there. So what's the reason for the flatness?
Well, so we could spend probably the rest of today and the month talking about this chart, which is slide 5. If somebody's been driving this. 2019, the state finished the Justice Reinvestment 2 initiative, and that created a major change in the sentencing structure and how DOC dealt with its population. So you begin to see a decline in 2019, and then the pandemic started right away. So it's hard to kind of parse that data apart, but I think what you see with the sentence number is the new baseline after justice reinvestment. So that was the delta that you see between kind of 2020 and 2021, 22. And then the line continuing is that's the new kind of norm based on the law and structure that we have presently. I think theoretically you could see that number tick up if the courts were to rapidly adjust their backlog and decrease their backlog. But I actually think that this is probably the range of new normal. What you're seeing though on the green line is the increase in detainees. And I think that does reflect the backlog. Part of that is more and more people are getting stuck in the system and their cases aren't being adjudicated. And until the matter is closed, they're hanging in there. I also think, during the same time frame, we moved largely to remote court. And I think that is contributing substantially to the backlog. I think cases are not moving through the system at the speed that they did historically. And then, there's a thawing of coming out of the pandemic. There's more activity now. So, during the pandemic, everybody kind of went to ground. And so crime rates dropped, everything. But you're seeing kind of a thawing and that's starting to get reflected in the detainee numbers. And I'm sure there's several other things impacting that.
Thanks. So we'll be able to ask Luders Dumont when he comes in more about it. Sure.
So I'll pause there.
Okay.
Happy to talk about any other pieces, but I'm going to hand it over to Kristen and she can take you through the numbers.
So that second packet you have, you can go right to page 2.
Just the usual salaries and things. We don't.
Yeah.
need to
Okay.
worry about those because everybody has them.
Sure, yeah. So that's all you're gonna see in this section, the B 335 Corrections Administration, along with internal service funds. So if you want me to skip over those, I'm happy to do that as well. Page 3, parole board, section B 336 is also salary and internal service fund. Page 4, corrections education, section B 337, also salary and internal service fund.
Is this where we put $3 million in budget adjustment?
No, remember we put that into a fund,
A fund?
so it wouldn't show up here,
Okay,
right?
all right.
Okay. And page 5, B 338, correctional services. Slightly more than staff salary, so we can, the first several lines, down to, let's see, the $11 million amount. That's annualization of salary and benefits. Excuse me, actually the one right above it, the 6.6 million. The rest, we're requesting additional funding. As you can see from the vacancies savings right below that, we're trying to right size and have some transparency over what our actual vacancies net us. But the cost of that are the two lines above, the 6.6 million and the $11 million per shift differential. So cumulatively, across the board, this, go ahead.
Sorry.
I saw heads down, so I figured
I was looking at the numbers to wave more.
Obviously, it's been an ongoing challenge with staffing in every walk of life, but especially in your area. The changes that you made, are we making progress? I mean, what is your vacancy rate right now?
18% for facilities.
Yeah, our overall vacancy rate system-wide, I think is about 15%. Yeah, 14.9 today. But we tend to look specifically at our security staff positions because that's the driver of this problem. And that is at 19. Security staff, folks who work in a correctional facility, uniform staff, or folks providing a security function in a correctional facility. The vacancy rate among that crowd, which is also the biggest part of our staff, is 19% today. So we have made substantial progress in the last 3 years in driving that down. But as I mentioned, over the last few months, we've really noticed a plateau. And so I think it's now incumbent on us to find that next batch of solutions to help continue to push that number downward. But I don't think ultimately the solution is more money. We have, I think, right-sized correctional salaries in the state. And there's a lot of national data that we're looking at that shows that in the last 5 years or so, we've increased salaries nationally for correctional staff about 25%. And yet we've lost about 20% of the correctional workforce. So there are other forces at play here that I think are going to have a much bigger effect on whether we're able to really tackle our staffing crisis.
Yes, Reverend Cavoni.
How often are our staff being hurt?
Like active violence? I don't have the exact instant rate on me today, but it's pretty low, particularly when compared to other correctional systems. Vermont is actually one of the safest correctional systems in the country.
So you don't think that's a factor driving the?
Well, I mean, I think the experience of a correctional officer is a difficult one, even if they're not being inflicted with physical violence on a daily basis. The rates of physical violence for correctional officers is much higher than nearly every other category of employment in the country. Far higher than law enforcement, far higher than combat military veterans. So looking at that nationally, it is true that correctional officers experience physical violence more often than nearly any other job in the country. But I think more insidiously in Vermont anyway, it's the trauma of just the daily work. It's the experience of working with a highly traumatized, highly complex population. There's, even if there's not physical violence, there's verbal violence.
Our workers' comp claims doing this?
Workers' comp is very high. Yeah. But that is also a long-term trend line. We see this career has higher workers' comp than many other careers.
Thank you.
Yep.
Okay.
Go ahead.
Okay. Okay, if there's no other questions about the staffing portion, the next one down is our offender management system. It's an annual maintenance cost increase as part of that contract. The next down is the year 3 negotiated increase for our health services contractor. 2.4 million.
That's the organization that serves the people who are incarcerated.
Correct,
Mhm.
yes. The next one down is the 5th year negotiated fee for victim notification system. And then the $650,000 is the next amount of funding to expand the pretrial services in the state.
An additional location, is that what?
Yeah, so currently we have it at Newport. We're recruiting for St. Johnsbury, and then we'll roll out from there as funding allows. The full category there for operating expenses are all internal service funds. And then finally, in grants, this is the 1115 waiver funding. You'll see it down in GF. And then the over to your right in the Medicaid line. And savings from that, just for your awareness, is going to the Vermont Chronic Care Initiative. Those folks will be doing the care management portion of the services. The next section down, B338.1, this is justice reinvestment. Earlier, we talked about transitional housing. This is where that funding lives. We don't have any staff costs associated there or internal service funds, but we also don't have any others increases there. Page 6, section B339, this is the out-of-state beds. No staff or other operating costs here. This pays for the out-of-state facility that we have currently.
How many beds are you paying for?
We have 119 there today. We think we can put up to 137 roughly there.
That's what the contract is for.
Yes. Well, the contract allows for a lot more, but the funding
Okay.
truncates down to the 137.
When does that contract or MOU or whatever you have with them expire? When do you have to renegotiate?
Let's see, I think 2 more years we would renegotiate. Each year there's a built-in per diem rate increase. But any savings we realize from a previous year, we roll over to account for that. So we haven't had to ask for an increase in years. The next one down, section B340, correctional facilities recreation. This is all staff salaries and expenses. And then finally, page 7, section B341, corrections offender work programs. These are all staff salary and internal service fund adjustments. This was the 3.1 million that we asked for in BAA to backfill the deficit. This reflects the removal of staff from that section.
So that means so none of the traditional offender work programs are operational.
Yeah, we still have the plate shop, so all license plates and all of that, and a graphic design shop, but only 2 staff are funded from this appropriation for those services. Yeah.
Okay. Any other questions from, I'm making sure I'm looking at you.
No, I'm
It is here.
not, I'm just listening to the background.
Yeah.
Yeah, getting the VSO listening to those are very, I don't know, the VSO is practicing across the hall, which is actually pretty special, but it's.
Yeah, it's a little disruptive.
Even as it's nice. Okay, so do we have any other questions for the folks at EOC? Huh?
Yeah, I may just go back a little bit to staffing in general. I just, over the years, I served on the labor committee, and so I'm aware of some of the issues that VSEA has indicated over the years, and they ebb and flow with as much as your graphs show. But in the end, no matter how few people or how few drugs are in the system, it's a really hard job. And I know that several years ago now, like a couple of years ago now, there was an agreement to go to 12-hour shifts And my understanding, correct me if I'm wrong, please, is that there is still pretty, because of the shortage in staffing, there's still plenty of mandatory overtime. And regardless of the contract, I mean, and we talk about how difficult it is to find people. I'm grateful, and I say this with all my heart, I'm grateful for the work that you do and that they do. But 12-hour shifts, mandatory overtime, it is a drain. And I'm just wondering what supports are in place besides or along with the benefits that are negotiated, and this is a mental health issue, this is a physical health issue, this is a marital health issue, this is a parent-child issue. And I can't even begin to understand the strain, the personal strain of people who work for us under these circumstances. And to me, there's not enough money in the world to compensate people for this kind of work. But how do you approach this reality again? I mean, again, I understand 12-hour shifts were negotiated, but that's a long day and you don't know if you're going to work 16.
Yeah.
I just want to hear that addressed, because you could tell I was on a policy committee before, and now this is a numbers committee, and we're paying attention a little bit more to numbers than we are to people. And I just want to spend a little time just hearing from you about, and also the strain on management. It's not just on the people who are on the front line, but I just want to leave that out there for you and just ask you, how do we balance this out? It's like, it doesn't, when I even say those words, I'm like, work-life balance. How do you have a work-life balance when you're working in a prison 12 hours a day, maybe 16 hours a day, and maybe you're sleeping in the driveway, maybe you're seeing your kids in the driveway? Where are we with this in the world?
Yeah, so we didn't talk much about the schedule change. Historically, we're on a 3 8-hour shift per day rotation, kind of standard, 8-hour shifts. And folks would work 5 in most facilities, although 6 in one facility days, and then they would have their days off. So that's pretty standard across industry. We heard loud and clear, we started surveying staff, which was a major sea change. We had never really done that before. And against a lot of pushback from the SEA. They did not want us surveying staff. But we got that into our side letter negotiations. That was how we got the surveys off the ground. We were able to start surveying staff. We started stay and exit interviews with folks who were leaving our system. And loud and clear, the thing we heard as the reason people were unhappy at work, or the reason that they left, was because they did not have enough time away from our facilities. It's exactly what you're talking about. No time to see their families, no time to go to the kids' ball game, no time to, if you didn't have family, go blow off steam with friends, whatever. There was no recuperation time. And it's because the staffing challenge. But when you have the 8-hour shifts, you have to staff 3 shifts in a 24-hour period. So you actually need more staff to do that than you do with a 12-hour shift. That's one of the virtues of a 12-hour shift, is you only have to staff 2 shifts in 24 hours. So you need fewer people. But the reason we went to 12-hour shifts is we were able to design a schedule that would give folks the maximum amount of time off from the facilities. It doesn't work perfectly right now because of the staffing crisis, but I firmly believe that is preferable to the 8-hour shift model. Because you will work 2 days and then have 2 days off. When you work 2 days, you have 2 days off. Then you work 3 days, you have 3 days off. And it keeps rotating like that. What that does is it interrupts the work period. So you have breaks in between, but in a 2-week pay period, which is how the state's pay is structured, you get 7 of 14 days off. And everybody in the system gets a 3-day weekend over the weekend, Friday, Saturday, Sunday. Under the 8-hour shift model, it would take folks 10, 15 years before they get a weekend day off. And so the whole design of our schedule change was to target that very pain point, that folks aren't getting enough time away from their facilities to regroup. It does not work as envisioned presently, but if we were to switch back to the 8-hour shifts, the pain would be much higher. So folks were routinely working 5 16-hour shifts in a row instead of 5 8-hour shifts in a row. Now we can at least break those up for folks. You know, ultimately we either need one of two things to happen. We need more people to come work in the Department of Correction, or we need to change the way we do work so we can do less for the number of people who work there. We're trying to target both sides of that equation. But the reality is the workforce in Vermont is shrinking. There's no cavalry coming behind, you know, there's new folks entering the workforce. And so to attract people to what is a very difficult job, my theory of this is we need to change the experience that people have at work. So that means changing the environments they work in. That's going to be pretty tough, but we're trying small scale stuff. We're looking to build a new women's prison, and the design of that facility would be targeted to be a more enjoyable place to work for staff. We're trying to change the way our staff interact with each other so that there's more human connection, that as supervisors are spending more one-on-one time with line staff, helping cultivate and just tend to those folks. We've introduced a variety of things over the last few years, like peer support programs, a clinical licensed psychologist, and all of that helps, but there isn't a silver bullet to this. And so we keep trying to find new ways. Now, what I think we have to do, and we've done it in small bites, but really need to think about is the way we've always run corrections in Vermont, but also nationally, is not sustainable. We are not going to be able to run these facilities the way we always have. So we need to find a different model to get to. And so that, you know, we're exploring, and I don't want to get too far forward on my skis, but exploring different models to be able to do that. Some of that's automation and some kind of technology supports that can help. That won't solve it all. And then I think it's how do you make it a more sustainable experience for a human being to go to work every day and do this job. And I think that's really tough. And I don't think anybody's cracked that nut yet, but I just, you know, several of my colleagues around the country are calling in the National Guard to run their correctional facilities because they do not have staff, to include New Hampshire, our next door neighbor. We don't want that in Vermont. That's not our model for corrections. It's not healthy. It's not good for the staff either. It's certainly not good for the population. So we're trying to get ahead of this curve. We're not, but we're close, I think, to at least keeping pace. But we've also learned a lot in the last 3 years. We don't have a recruitment problem. We're actually really good at recruiting people, strange as that may seem. We're running the biggest academies we've ever run. Routinely, every academy is 50% higher than our average. We have a retention problem. We can't keep people past a year. We're lucky to keep them 6 months. And that's because folks enter a system and what they experience is a lot. It's intense, it's difficult. You know, we're largely recruiting millennials and Gen Z, and their life experience compared to what they experience at work is so vastly different. I think that alone is jarring. And people are like, we're still using clipboards. They're like, what's a clipboard? You know, that's the delta between the way the world works and the way corrections works is so big that I think it's really hard to convince people that like, this is the place you want to spend your career. It doesn't have to be that way though. And we're trying to get back in position on this issue. But also I'll tell you, I've not seen any compelling data to say, if we just keep raising salaries, we're going to figure our way out of this. It has not worked anywhere in the country. And we have very close partnerships with corrections agencies across the country. We're studying each other's data, trying to figure this out. What you see often, you increase pay, you get a momentary bump in the number of staff, and then it drops right back to where you were, almost across the board. And so that doesn't mean people don't deserve pay. To your point, I mean, these folks deserve all the pay in the world for the work they're doing on a daily basis. And yet that isn't going to be the solution, at least not alone. We need to do other things. And so for so long, we've just resorted to the pay issue and we haven't explored all the other things that are impacting our folks. So that's our philosophy on this. That's how we're working the issue. And we hope we can get it, in a better place as soon as possible.
Thank you.
Thank you. Did you have one last?
I just,
Great.
as somebody who worked in a nonprofit, works for women for many years that worked with the correctional system, I've been very grateful for your leadership and the ways and the questions that you're asking, and the ways in which you are looking beyond our borders and how things are done, have been done here, to try to address what you just talked about. So anyway,
Yeah, thanks.
thank you.
I mean, the tough part, the other part of that issue though, is Vermont is actually, I mean, I think it's the best correctional system in the country. I'm obviously biased, but we are the leader on almost all of this work. And so it's like, if we can't figure it out, like nobody else has figured it, we need to get ahead because we are the ones who, we have the guide on, we're running with the flag. And so I hope we can figure it out. I think the time is right. Clearly people are suffering and the experience of staff is experienced by our population and vice versa. So we owe it to everybody in the system to get this right.
Thank you for all you're doing. Thank you for your time today. Thank you for your patience as we ran late this afternoon, but we're glad that we were able to have you in and appreciate all the work that you're doing.
Great. Thank you all very much.
Area, so appreciate it. Committee, we're meeting starting at 9. We have VPIC, the pension investment. And then we have judiciary, state's attorneys in the morning, and then we have our joint public hearing for the budget tomorrow afternoon. So you'll hear about that, but we start